Welcome to our 90 participants online. We're so happy to have you with us, and welcome everybody to the Global Brain Health Satellite Sessions. We're going to get started officially now, so thank you for being with us. Victor Valcour is going to share more about why and how we envisioned this time together today. I want to share a few logistical notes. And the first is for our people online. If you are in another country and you prefer to hear these remarks in a different language, you can go ahead and choose from your settings the captions. And from there, go ahead and choose a language. That should be an option for you. So please feel free to do that. This whole session will be an hour and a half as we watch videos from around the world and hear from speakers who are scattered around different countries who are going to share more exciting experiences about their recent work that GBHI has funded. And we're very happy to have this time to celebrate 10 years, a decade of global brain health equity leadership with our fellows. So with that, let me introduce, thank you. I'm going to bring to the microphone Dr. Victor Valcour, who is our site director and was here from the very beginning. He's going to tell you more about these satellite sessions, and we will go from there. Welcome, Victor.
Great, and welcome to everybody online and here. Thanks for coming in this morning. I'm going to be quick because we really want to be global today. That's me. Somebody put that slide in. So welcome to this event. I was reminiscing a little bit about what has happened. We were just talking about Cuba, and I think everyone remembers that quite well. I may have the date wrong. I learned last night. It was probably 2014 when, as Bruce says, he met Chris walking back from the Giants Stadium area after the last time the Giants won the World Series that year. So it was the first opening game in 2014. But we really initially started this program without much money, as I was saying, but enough to get started. And we enrolled our first cohort in 2015. And we had until 2019 to demonstrate we could do something to get the rest of the funds in order to move forward. And during that time, we started doing quite a bit of stuff in research and policy and in arts. And I just thought I'd put a couple milestones in here to remind some of the people. We early on partnered with the Alzheimer's Association to fund the pilot program. Some of you heard that yesterday. This partnership is now 10 years old, but we started also working with our fellows to raise money in research. The World Federation of Neurology and the Fogarty Center were some of our earliest grants that we received. Our partnership with the Alzheimer's Society in the UK then came around 2018. We landed our fellow, I'm saying I'm talking about our global community of fellows. We landed our first major grant from NIH in 2019, which then became REDLAT. It was a $2.5 million grant, but the work that was put into it, Augustine Abenya is one of our fellows, and Bruce Miller wrote a grant that really required $20 million, and we got 2.5. So we rapidly started raising money from multiple partners, including the Alzheimer's Association, to run REDLAT, which is now independent. We've then got multiple grants from the Alzheimer's Association, our ones from NIH. The Alzheimer's Association partnered with us to build capacity grants. In 2024, the second round is now active. We now have, we got 2 of 5 of NIA's grants, these UG3 capacity building grants. They offered 5, and 2 of them went to our community. And the most recent round of grants from NIH, 4 of the 6 went to our community. So we've really grown tremendously in our capacity to do research, but it's not the only piece. We've done so much also around the arts. We funded Citizen Brain with Josh Kornbluth early on in 2017. Atlantic Fellows started telling their own stories. We have even people who are not artists started telling wonderful stories. My Brain Roby was created by a rehab neurologist. We funded a film, which now is, some of you have seen, Keith's Bags, Names and Words, that was shown. We started our partnership with Conservative Music in San Francisco and did 5 live events with them over a period of time. The Creative Minds project was funded to Sergio Lanata in our outreach for ADHD, which was transformational because just dozens and dozens of our creative types have worked in the community to provide opportunities here in San Francisco and dig into brain health. The Unraveled play is now live. Initially, it was a virtual play. It went live last year, and now it's going around the country. Coco Suzanne was funded, which is a film on the Congo that was created by Zach Bandler and Emmanuel Apendi. And now we're starting all these podcasts, films. We have an article of a fellow in Peru that was picked up by El País. Susanna Ley wrote that. And so there just has been creative, huge growth in both the creative side and the research side. And I was going to make another slide about advocacy because I could do the same thing, but I realized I really don't have enough time because we're really here to talk about the global community. 337 fellows in 70 countries over 10 years. And the way we considered today is really a philosophical consideration. The Atlantic Fellows for Equity in Brain Health are the center of everything that we do. We really want the fellows to be at the center. So how do we do that? We borrowed from Maria Carrillo's program, the Neuroscience Next, and we decided to fund sites around the world to celebrate. So we're celebrating all over the world. And we have 5 people who will represent that today. One program is in Peru. It did a science program, and we'll hear from them a little bit later. We have a play that is being launched in Buenos Aires by Danny Macri and the group down there, and we'll hear from them as well. We have the Brain Bus that's across Francophone Africa and France, initially in France and actually a bus, but I think now it's a virtual bus and all over the world. We have an art exhibit that's going on in Kampala. And finally, we have a group that's still awake at 2 a.m. and around a campfire in Australia celebrating sleep and brain health, and will come to us live. So it's really a fantastic celebration around the world that we're all going to hear about. So thank you. I'll hand this off. What a privilege it is to be part of this community. Let's begin the celebration.
Thank you so much, Victor. And so, as you said, we're really centering ourselves in people and in place. This is about the Atlantic Fellows who are all around the world today. And we're going to hear from them next. I wanted to also introduce myself since we started again. So I am Camelia Lata with the Global Brain Health Institute. It's been an honor and a privilege to be working with our alumni community for about 8 years now, nearly 9. And we're going to hear from several of them today. So let's get started. We'll start with our Peru satellite, and we're first going to watch a video about their work just this month that was funded on the occasion of GBHI's 10-year anniversary. Let's watch more.
Hoy estamos en un momento histórico para nuestro país, tras el lanzamiento del Plan Nacional de Prevención y Tratamiento de la Enfermedad de Alzheimer y otras demencias 2026-2028. Bienvenidos a todos.
El evento Cerebro, Equidad y Resiliencia busca ser una plataforma para impulsar el Plan Nacional de Demencia en Perú. Contamos con profesionales de la salud, investigadores y la comunidad para generar nuevos conocimientos y discutir lo que justamente se tiene que implementar y cómo es la manera que se tiene que implementar en nuestro país, siendo un lugar tan diverso, con tantas regiones y culturalmente que nos da diferentes visiones de cómo podemos llegar a la comunidad.
Cuando pensemos en políticas públicas, no solo pensar en, digamos, diagnóstico, tratamiento, medicamentos, sino cómo protegemos a las personas que tienen ciertas condiciones o las familias de las personas que tienen estas condiciones, ¿no? Nuestra mirada no tiene que ser solo a la enfermedad, sino a la persona con su entorno.
Nos encontramos en torno a la conmemoración de los 10 años de Global Brain Health Institute. Es importante llevar siempre presente nuestra labor de líder en cuanto a salud cerebral, en cuanto a demencia o compromiso cognitivo.
El GBHI cumple en ese sentido un rol fundamental porque nos acerca a los investigadores con las políticas públicas. Y es cierto que demencia y salud cerebral depende mucho de políticas públicas más de que factores individuales.
En esa función es que nosotros hemos podido buscar las formas y las oportunidades de poder conectar con el Ministerio de Salud, con instituciones públicas, instituciones privadas, nacionales e internacionales, que finalmente han ido vertiendo ideas, han ido colaborando de forma paulatina, pero de forma constante y soportada, que creo que jugó un gran rol en la publicación del Plan de Demencias.
El Plan Nacional no es solo un documento técnico, es un compromiso por el acceso justo al diagnóstico y tratamiento en cada rincón del Perú.
El plan es muy interesante porque implica no solamente el sistema de salud, sino todo lo que tenemos alrededor del sistema de salud, particularmente la familia, los cuidadores y en el punto de vista del sistema de salud, la atención primaria. Esos tres aspectos se vuelven críticos, más importantes que las grandes especialidades, que las grandes metodologías de diagnóstico. Mucho más importante es las personas que están directamente en contacto con el problema de fondo, la demencia.
El cuidador es una pieza clave para que los pacientes puedan sobresalir en las recomendaciones que los diferentes especialistas les piden. Haciendo énfasis en el cuidado emocional que debemos de prestar al cuidador, puede dar mucha fuerza a los diferentes programas que se llevan con pacientes con demencia y con Alzheimer. Mente, además, ¿no?, está poniendo en evidencia lo complejo que son los pacientes con trastorno neurocognitivo. Esto nos obliga a formar equipos multidisciplinarios, capacitados, entrenados, sensibilizados y comprometidos con tratar de aliviar el camino del paciente con trastorno neurocognitivo y la entrega de amor que tiene su familia cuidadora. Asimismo, cómo saber cuán difícil o qué barreras, qué limitaciones, qué facilidades podemos tener para la implementación de este tipo de sistemas de cuidado y de entrenamiento y de soporte de pacientes con trastorno neurodegenerativo en un sistema público de salud peruano.
El día de hoy hemos discutido acerca de la importancia de la formación y de la investigación en las demencias en nuestro país, aspectos como la importancia de la institucionalización de la mentoría en investigación, utilizando, por ejemplo, instituciones locales, oportunidades de colaboración internacional, para que los nuevos investigadores puedan tener estas oportunidades de capacitarse en diversos aspectos de la investigación.
Para el plan actual sobre demencias en el país, es muy importante que nos enfoquemos en hacer vínculos con las organizaciones nacionales que brindan fondos para investigación. Con fondos para investigación puede ser orientada específicamente para implementar el plan a nivel de atención primaria, a nivel de centros especializados y a nivel de educación en salud, que es donde necesitamos fortalecer no solamente las bases, sino los vínculos entre las organizaciones que están involucradas en estos pasos.
El que exista ahora un plan nacional de demencia en un momento histórico para el cambio.
Yo soy cuidadora, estoy desempeñando ese rol por familiar, por mi hermano. Entonces yo me estoy involucrando en todos estos temas para poder ayudarla y ayudarme a mí para no caer, ¿no? Porque yo también ya sé que tengo que cuidarme, para poder cuidar.
Muy agradecida con el taller de movimiento, la verdad, encantadísima. Nos ayudó a todos a salir de, como llegamos de una forma y cuando salimos de otra forma. Me voy muy, muy enriquecida con muchas cosas buenas que aprendí el día de hoy. Gracias.
Cada persona que sufre de algún trastorno mental sigue siendo un ser humano que siente, que tiene emociones, que también tiene temores. Si bien sabemos que esta enfermedad es progresiva, no es estacionaria, eso no significa que nosotros también seamos pasivos, sino que sigamos moviéndonos al compás de cómo avanza esta enfermedad y brindar una atención de calidad, empática e integral a estas personas.
What a delight to see that video footage from our Peruvian fellows. Wonderful. And now we'd like to welcome directly from Lima, Peru, Marianela Illanes, who's a psychiatrist and Atlantic Fellow for Equity and Brain Health, together with Nancy Romaldo, who's one of her colleagues. Nancy is from Atlantic Fellows for Health Equity, and she will also be joining them as part of the organizing committee. So we'll welcome both of them to join on the Zoom camera to share about 5 minutes of reflections from this time that they spent together, collaborating and working on further implementation of the Peru National Dementia Plan. Marianela, are you with us? Hello, welcome. Welcome from Lima.
Hello, everyone. Thank you so much. Well, I'm not in Lima. I'm in Piura. It's in the northern part of the Peru.
Thank you.
But from Peru, we are really excited to be part of this celebration. For us in general, for all the fellows from Peru, we consider that celebrate the 10 years of GBHI is an important event because it represents the power of the collaboration. I would like to acknowledge the teamwork and commitment of Sheila and Nancy. This event that it was supported for many people, in special UCSF and my teamwork here in Peru. And for me, GBHI maybe is the most important step in my life because not only improved my knowledge about brain health, dementia or something, opened my mind maybe because I expand my knowledge to other countries and expand friends around the world. That maybe is the most important thing because I really appreciate these years in the CSF and in special Dr. Bruce because he's an example as a leader and inspiration for us for being a leaders in our community, in our countries. Gracias por todo, GBHI. 10 años más.
Wonderful. Thank you, Marianela. Thank you, Nancy.
So, to be honest, it's a totally pleasure to stay with all you. I am, like Camila mentioned, I am Senior Atlantic Fellow for Health Equity, but I think that Brain Health Fellow is like my family too. Thank you so much for all this careful with me, but I think the most important thing in all this process that how we can to integrate all this topic in relation for dementia with other topics. We need to introduce topics like nutrition, maybe the community, because if we have the power to change this illness, maybe not in long steps, but we can do step by step change the reality. And I trust in all of you. And I think that if we can work together, to be honest, we can to do amazing things. Thank you so much for your careful, for your friendship, and we have the power in our hands. Thank you.
Wonderful, Nancy. Thank you. And stay with us, both of you. We have one question. We also want to underscore what you said, Nancy, about together we can change the reality. And that's what this movement, this community together is all about. Thank you. And we have a question from Victor Valcourt.
You can't get away from me, Marianela. I have just one question. First of all, thank you so much. What a celebration. I love the fact that you had science, you had caregivers. You really did a wonderful event. You included all of the fellows from Peru. We see Alex Kornhuber's pictures. It's wonderful. Many people in the audience may not quite understand the context of celebrating the National Plan for Dementia. It is the 10th anniversary of GBHI, but could you also share with us the celebration you're having this year about having a national plan for dementia in Peru? Hablar un poco sobre el tema del National Plan de Perú. Es nuevo en Perú, entonces quizás es importante compartir con todos los participantes aquí porque estabas celebrar el plan este año. Can you tell us? Hablar un poco sobre eso?
Yes, thank you, Victor. Well, in case of Peru, we don't have any national plan to dementia that was approved the last year, but the truth is important document because it's a step that permit the people in a special caregiver or all the people that suffer dementia maybe can access to a health or other service in part of this study. However, in our countries similar to Latin America or other places, maybe it's not easy. We have a document, but we need to implement that. This is the reason we developed this event, to try to push that, because the community maybe in Peru is the most important part, because our politics is not stable. Maybe, do you know, in Peru we have many presidents in short time, and when we try to push something in a Minister of Health, for example, we need to the community involved in this. GBHI was an important entity that, because support that this plan was approved the last year, and Impact is the other project or institution that support that. But maybe now the most important challenge is how we implement that. And maybe as a fellow, as a psychiatrist, and a doctor that working in the public system, we need to involve community. Maybe it's the most important part that this plan became a reality, because we have the document, but sometimes in our countries, this document can slip maybe days or years. And this is the reason we developed this event and include community as a part of that.
Wonderful. Thank you so much. And with that, we're going to say thank you and goodbye, but we're glad you're going to stay with us throughout this session. As we're rotating into the room here, before we do, I want to acknowledge our colleagues who are tuned in from Trinity College Dublin. We know there's a group of fellows who are sitting in a room together on campus watching this webinar, so we appreciate them. We acknowledge them as our sister site at GBHI. And with that, I'm going to bring up our founding director, Dr. Bruce Miller, who will share a few words about leadership. At GBHI, as our additional audience members may not know, there is a solid curriculum that is in place that talks about leadership skills. It's a crucial central point of how our fellows learn and how we also, as whether we're staff members, faculty, develop ourselves as well as part of this global community. So I welcome Dr. Miller, who's going to share a little bit, and you can come to the mic, or I can give you a
Thank you, Camelia. Muchas gracias, mis amigos y amigas in Peru. You are very mighty and powerful, and you are changing your world and changing our world. My memories for all of you, Marianella, Sheila, Beatrice, burn bright. So I always start, I think, with something from Bob Dylan, or well, I will today anyway. So, and the song is "Shelter from the Storm." And as I think about the past 10 years, I think of all of you as my shelter from the storm. And I'll just read a few of the lyrics. I was burned out from exhaustion, buried in the hail, poisoned in the bushes, and blown out on the trail. Hunted like a crocodile, ravaged in the corn. Come in, she said, I'll give you shelter from the storm. Suddenly turned around and she was standing there with silver bracelets on her wrists and flowers in her hair. For my generation, for my ilk, flowers in the hair is big. Okay. She walked up to me gracefully and took my crown of thorns. Come in, she said, I'll give you shelter from the storm. That's how I think of GBHI for me. And I think of my amazing colleagues who have accompanied me with it throughout this journey. Huge thanks, Dr. Rompale, guest here today, and Maria Carrillo. So Dr. Rompale got to read her autobiography. And anyone who is interested in activism, in making a difference, should read this book. It's about her life from a very young student in South Africa during a time of enormous change. People had the opportunity to sit on the sidelines or do something really important. And I was telling her earlier that as I thought about her and the book and leadership, three things really stand out, which I love. And all of these have a circuitry in the brain, and our fellows have done beautiful salons, as Victor calls them this year, about authenticity, fairness, openness, respect, courage, and empathy. The three values, they're all in there. They're all in the book. But the three values that I really think of with her story is authenticity. So utterly honest and transparent, and I would say self-aware, understanding who she was, what that time was. It's the honesty of the book is truly extraordinary. The second part that you'll never forget is her courage, her willingness to take on and challenge authority, even at the risk of death. And she did it in such an incredibly intelligent way. As the third value I just want to touch on was her empathy. So there were no enemies. There were enemies, but for Dr. Mpale, it was all about being effective, seeing all of these individuals, police officers, army, as potentially, as all human beings, as people who could understand who she was and what her movement was all about. And I think all of us are facing these enormous challenges in 2026, whether we'll be constants going back to whether it'll be Abel going back to Uganda, Abera in Ethiopia. You will face enormous challenges. But I know that the values that you had before you came, that have been reinforced and built within your brains, will allow you to do the biggest and bravest things in your worlds. And the last thing I would just emphasize is that, as I said at the first talk 2 days ago, I'm the founder of the Memory and Aging Center at UCSF, and I'd never written a paper about memory before until I'm working on one now, and it's about remote memory. And then the aging, I'm doing very well, so I have total credibility in the aging space. But for the memories, I have these fragments of emotional memories. I wanted to share some today, but I've run out of time. But I have each and every one of you in a fragment, like an artist would, a photograph, a little tiny piece of film, a little piece of someone like Leo acting. You have changed my brain, you've changed my life, and my gratitude could not be higher. Thank you.
Thank you, Bruce. And for our participants who are online, what we want to just mention here is you've been hearing about this Global Brain Health Institute, and each year we have a cohort of fellows who joins us, whether it's here in San Francisco or in Dublin, where Trinity College Dublin is located. They spend about a year with us learning, bonding together, and then going back to their communities to apply that knowledge in their communities. Right now at the Global Brain Health Institute, there are 300 fellows around the globe who are bringing that knowledge back to their communities within the larger Atlantic Fellows community across 7 equity programs. There are thousands of fellows who are implementing this work. So we want to acknowledge that context as we're thinking about folks who are currently in our training programs right now that Bruce mentioned that we are so proud of, and those who are also at our sister site. As we continue, we are going to go onward in our journey today. So let's move on to the next satellite location. It's now my pleasure to bring us to Argentina. We're going to travel to Buenos Aires next. And we're going to hear from an Atlantic fellow named Danny Macri. Danny, as you can see, works in the art area. He is a musician, an educator, and an engineer. And he worked on a play, which we know as La Madre, and he named it with a different title that you'll hear more about. As you watch this video clip, what we want to invite everybody to do is to stretch your minds a little bit, because this video will be in Spanish. And so we invite you to channel the value of empathy and say, what does it feel like to listen to a different language when it is not your first language? What tips do you pick up on? Cues, visual cues, facial interaction, all of that. So for those who speak Spanish, wonderful. For those who don't, look for all of these cues and have that moment of empathy with everybody else who is absorbing what we will learn from Danny and his work that he has had this month. Let's see the video.
El Instituto Global de Salud del Cerebro es un instituto que está globalmente en todo el mundo y tiene un programa donde el objetivo es mitigar el impacto de la demencia desde las distintas disciplinas. Tiene un programa de formación para médicos, artistas, hay de todas las disciplinas donde cada uno puede aportar desde su lado para decir cómo podemos mitigar esto, porque ninguna disciplina tiene todo el saber, sino que nos vamos complementando. Entonces yo puedo enriquecer desde mi visión la visión del otro me enriquece con la suya. Este instituto existe hace 10 años, este programa existe hace 10 años, en ocasión de su 10º aniversario nos encontramos acá y la propuesta es compartir un poco unas preguntas, ¿no? Porque la obra esta, bueno, al menos a mí, yo cuando la vi la primera vez y cada vez que la actuó, moviliza, hay algunos momentos, ¿no? Donde siempre nos remite a alguna historia que alguno tuvo o puede tener. Sol, si nos querés contar, ¿qué es la demencia?
Creo que ilustra bien bajo el paraguas de lo que llamamos demencia, ¿no? Problemas de memoria, problemas de conducta. Y esto no es normal, no es una parte normal del envejecimiento, no es por una enfermedad, es diferente del envejecimiento. O sea, la edad puede incrementarte la probabilidad de tener unas enfermedades asociadas con demencia.
¿Qué síntomas, más allá de la pérdida de memoria, que es lo más normal que tenemos por ahí, que todos conocemos, existen dentro de las demencias? ¿Y qué consejo nos puedes dar como médica?
Finalmente, culturalmente asociamos los olvidos con la demencia, pero la realidad es que, como pudimos ver ilustrado en la obra hoy, hay otros síntomas, como por ejemplo los conductuales, las alucinaciones. El paraguas de síntomas es bastante más amplio que solamente los olvidos o la desorientación. A veces es más fácil el olvido, entenderlo como parte de la enfermedad, pero las reacciones de enojo tan fácil, de suspicacia, o de burla o de comentarios hirientes, es importante que también entendamos que muchas veces son parte de esa disregulación emocional.
Pepe, como director de esta obra, ¿cómo fue para vos encarar este trabajo artístico tratando de conservar la estética y por otro lado sostener el rigor académico, digamos, ¿no? Intentando sostenernos desde la ciencia también?
De entrada nos dimos cuenta que la obra tocaba un tema doloroso y tenía una vocación trágica muy, muy marcada. Entendimos que por el lado del humor había una chance de que el mismo mensaje llegara con otro envase. Y creemos que la nota trágica llega igual, lejos de querer reírnos de una enfermedad tan triste. Creo que aprovechamos o intentamos aprovechar todo el humor involuntario, que hay confusiones, hay accidentes, y esos son elementos de la comedia.
Tuviste una experiencia de cuidado bastante fuerte. Quería preguntarte qué nos podés recomendar a quienes por ahí tenemos que vivir una situación parecida pronto, o la vamos a vivir, o la vivimos.
Creo que es un contexto que está bueno que nos llamemos como abrazarlo y no negarlo. En mi caso, el no entendimiento, pero bueno, era un poco invitarse a jugar la fantasía.
¿Cómo les parece que se relacionan y se enriquecen la ciencia, el arte y el cuidado?
La obra hoy nos muestra cómo es una forma de transmitir esto que a veces tratamos de explicar, ponernos un poco en el lugar del otro y confundirnos todos. Creo que con el confundirse cuando vimos entrar a otra persona que era parecida, pero estaba vestida distinto, pero se llamaba entonces quién era, creo que es una buena forma de dar la empatía y de que podamos ponernos en el lugar del otro y entender y explicar y quizás generar conciencia sobre algunas cosas que de otra manera pueden ser muy difíciles de explicar.
A veces los científicos trabajamos con bases de datos y con estadísticas, y a veces se pierde un poco el contacto directo con la gente y lo que te despierta estar con las personas para generar nuevas ideas desde la empatía y la conexión.
Yo no puedo ser muy objetivo porque me dedico hace muchos años al teatro, pero el teatro sigue siendo un espacio donde la sociedad, si tiene la disponibilidad, puede reflexionarse a sí misma. Bienvenido a estos espacios para no negar ningún rincón de lo que le pasa a la sociedad.
Gran parte de haber atravesado esta experiencia tenía que ver con un cable a tierra, con trabajarlo, con escribir, con componer. Hay una canción que después en un momento yo terminé haciendo, después la grabó Dani, creo que forma parte de algo de este proyecto. Me parece que siempre es importante llamarse a indagar y a tener un cable a tierra artístico.
La expresión artística nos permite también compartir. y de repente un montón de cosas que no tenemos cómo bajar y salen de esa manera y que después eso habilita una posibilidad de diálogo que, nada, que por ahí otras disciplinas son es un poco más difícil para conectar con uno mismo, que uno no deja de ser uno todo el tiempo, en realidad, ¿no? Así que bueno, un poco con esto agradecerles un montón a ustedes por estar, al sonido de las fotos, al panel por responder estas preguntas.
And we're going to just move a little bit further on in the video. And we are at the end of the video. Wonderful. And Danny, we want to welcome you onto the screen. I invite you to turn on your video and unmute Danny. And if you are there with the rest of your team, we see your co-collaborators there. We'd love to hear more. Hello, Buenos Aires. Welcome, welcome. We'd love to hear more about the context of what we were seeing with the play. Hello, everybody. And perhaps you could introduce yourselves briefly to all of us online and in this room in San Francisco.
Hi, I'm Danny. Adolfo here, and many other fellows and friends and colleagues from our team here in Argentina.
Wonderful. It's great to see you. Can you share more about what we were just watching and what the goals of your project were and how this connects to brain health equity?
Yeah. So we had a theater play called Olivia, which goes about a woman who has dementia, was created, also adapted to Buenos Aires in collaboration with Lucia, who's a neurologist here. So I put together this director and then the neurologist to create, develop, adapt this theater piece. With that, then we had, after the play, who was a normal play in a theater in Buenos Aires, we invited Lucia and Sol, who's a neuroscientist and there. And then we had also the theater director and a caregiver. So we had a dialogue with the community, asking them, okay, what are, to use that opportunity to disseminate knowledge about dementia, caregiving, and brain science. And then we had a community moment with the whole audience to exchange their thoughts, their reflections with the different professionals. And this morning, and in addition to the play, we took the opportunity to disseminate what GBHI has done over these first 10 years of its existence, what it's meant to us fellows, and how we can empower people who have not yet had a chance to venture into GBHI. And it was a moment of celebration. We were, in addition to just sharing some presentations that we had prepared, it was a very, very engaging moment of reminiscence. We were sharing anecdotes about what GBHI meant for us, fun stuff, the challenging stuff, the lessons that we learned, and the transformational experiences that we've had in our time as fellows. So I think I speak for all of us when I say that we are very proud. That was a very recurrent theme in what we were sharing today. Thrilled about GBHI and its first 10 years, but even more excited about the following 10 years because the momentum has kept growing, and we feel a part of it, and we feel privileged to be a part of it. So here we are, and thanks for the opportunity to be a part of this fantastic global celebration.
Wonderful. Thank you, Adolfo and Danny and the whole team. I do have one question for you. You know, Adolfo, you talked about the future forward-looking direction as we move forward from these 10 years onward. Can I ask you together, your group, why is it important for the arts and the sciences and everything in between to collaborate together? What does that mean to you?
I think we can all say, I'll just say two words, but the very fact that we have different words and might, for art and science, sometimes implies that they are different things, and people may often take it to be very different, radically different, incompatible things, and that is a fallacy. It's a fallacy in the sense that there's a lot of creativity in scientific pursuits, and there's a lot of logical reasoning and sometimes even quantitative thinking behind a thoughtful piece of art. And GBHI has sort of effaced the boundaries between one thing and the other. That's something that we've all learned about, I think. And Danny, you probably have even better things to say about this.
Yeah, I mean, to me, the important thing is that no discipline can explain the reality as a whole, because each of us has its own look. So each discipline can enrich the other one. And then when we invite everyone to have a dialogue, we can get a closer approach to what the reality is. And if our mission is to mitigate the impact of dementia in the world, we need the collaboration from everyone, from every discipline, from every part of the world. And we cannot exclude leaders or people who are working in different fields. We need to ask for radical collaboration, which is something that we also train during the program. And that's why I encourage all other artists or all other people that are working in very different fields that are not only neurologists or people from the medical sciences to be a part of this community, because it's really empowering, and then we can create marvel things that we are not thinking about them before.
Thank you for modeling that so well. We appreciate you. Congratulations on all of your work. And yeah, I think I just want to underscore, to mitigate dementia and its impact in this world, collaboration is key. Thank you, Buenos Aires.
Bye.
Okay, now we're going to move back into the room. So we're going from Buenos Aires back to San Francisco. And I'd like to invite back up Dr. Leah Grinberg, who is on our GBHI advisory board, and she's also with the Mayo Clinic. Dr. Grinberg, Leah, as we know her, so lovely. She also served on GBHI faculty for several years and was highly, deeply involved in the recruitment and selection process of our fellows at GBHI. So let's hear more from Leah shortly.
Thank you, Camila. And it's so good to be here. And I don't see you all at Zoom, but I think I can feel your vibes. The weather in San Francisco has been awesome. And I think we are all celebrating the amazing accomplishment that is GBHI. And as we heard this morning about the history of GBHI a little bit and some accomplishments, and we are seeing from our fellows and communities what is going on around the world, I kept thinking that every time I talk about GBHI or everything I think about GBHI, what I will tell people is what a miracle it is. And if someone will describe to me a program like this and everything that's happening around this movement at GBHI, I will not believe if I would not be able to witness this. And then I thought also, well, but I'm in a position of privilege because I can witness not only what people tell me, what I see, but all the opportunities I have had in joining the founding members, in understanding what is the program and all the staff and all the fellows. And this is what I would like to share with you today, some of my experience. Because I think that GBHI is not only an institution or a fellowship program. It's really a story that happens when a very bold vision, and I want to repeat, a very bold vision is carried forward by a community, and again, community of people who believe deeply enough to make it real. And this is not taken for granted. So as I mentioned, I had the privilege of being involved with GBHI from the very beginning. And I had the privilege to serve at the executive board, now part of the governing board, of course, selection, membership, and I was able to watch GBHI grow from idea to a program, to a community, and now what I think it's a global movement that's growing and growing. So when I think about leadership in action, the first thing that comes to my mind is vision. So GBHI is a miracle, but it's not something that just happened by a divine wish. It happened because of people who are in the ground. And it begins with the vision that brain health, it's a matter of equity. And millions of people live around the world with dementia, and they still face so many problems, misdiagnosed, delayed diagnosis, stigma, everything that comes around it, and of course, much worse in low and middle income countries. So GBHI was created to respond to this reality, not only with research and care, as we heard this morning, but investing in people, in arts, in all sorts of creative minds from across the board to make it happen. Now, This is where I think GBHI is very special, because many people talk about equity and talk about let's promote equity, but only a few are really able to make an aspiration to a concrete action at global scale, how GBHI is. GBHI had transformed the idea that brain health equity could be an aspiration to a living network of people, of projects, of partnerships, of mentorships, and at the end of the day, big impact in our communities. And we mentioned Chuck Finney this morning, but I think we can never, it's never enough to mention about his vision and the vision of the Atlantic philanthropy and the idea of giving while living. That's not just about generosity. It's about urgency, which I think it's very part of GBHI. It's about how we can use resources during one lifetime and even our lifetime to really create real change in real time, to invest in people and to trust these people that they will carry the work forward. And under his leadership, and Chris, I have to mention you, I came late to the game. I never had the opportunity really to meet Chuck when he was doing what he was doing, but I had the opportunity to meet you and know the vision that you carry and your mission and how you have been guiding us and steering us and walking the walk with us all these years and really making us better. Because I remember many and many occasions in what we had a question, you had a situation that was difficult, and you came with your wisdom, with your calm, and somehow you brought the solution for us. So thank you very much. And I really wanted to make this mention to you. Now, today, this vision and everything that came through this came here at UCSF on the leadership of Victor Valcourt, Bruce Miller, Shireen, I'm out of time, and Stacy, and well, there's so many things to say. Anyway, I'm out of time, so I'll be 30 more seconds and I'm out. So I just wanted to finish to say that nothing about GBHI was accidental. This program has built with purpose. The faculty, the staff, the mentors, the partners, the selection process is all shaped around the same goal: to give fellows the knowledge, the network, the confidence and support to drive change in health equity around the world. And I will finish with this. Things were done with purpose, things were done intentionally, and this is what we need to do to get aspiration in great ideas. And we could not be in the hand of the best leaders, and I'm not just talking about the leadership of the program and several aspects of the programs, but the fellows who were already leaders and they continue to be and growing as a community and really making a difference around the world. So happy birthday, GBHI, happy birthday to all of us and many, many years to come. Thank you.
Thank you, Leah, so much. All right, friends, we're going to keep going on our journey around the world. So we're here in San Francisco. And next up, I'm very excited to introduce our Francophone site, which today is based in Lille, France. But they have been venturing across various Francophone countries, and we're going to hear more about it in their video and in their remarks afterwards. So you can see the different fellows who are involved in co-leading this project together. You heard it alluded to earlier about a brain bus for advocacy. It was more of a virtual bus, so we'll hear more in a bit. Let's hear the video.
Hi, I'm Dr. Yahua Chen. I am neurogeriatrician from Lille in the north of France, and also a senior Atlantic fellow from the 2019 cohort. It is my pleasure today to present you our project with our friends, colleagues, and fellow fellows. So to mark the 10th anniversary of the Global Brain Health Institute, we organized a public awareness campaign. The name is En route pour la santé du cerveau, which means on the road to brain health. It is a series of scientific events and lectures taking place across several French-speaking locations. We use the metaphor of a bus to highlight the importance of protections of brain health as a lifelong journey. We would like to tell everyone that it's important to protect your brain health at every stage of your life. So as you can see here, we will stop in numerous French-speaking countries such as France, Belgium, Mauritius, Congo, Togo, and we will have interactive workshops, short science communication presentations, film screenings, and open discussions with the participants. From sleep and cognitive health to prevention and creative engagement, each session offers practical insight and share the learning grounded in real-world experiences. So, are you ready to get on board on our brain bus? I hope you are. Let's start with France. In France, I'm going to present the experience from Lille, from my city, where we led a multi-component community-based platform for a better, healthy aging. So we know that brain health is not just about having good cognitive evaluation. It's not about the absence of neurodegenerative disorders. We imagine brain health as a lifelong dynamic process that includes cognitive domain, but also physical health and overall well-being. So in our program, we offer people the possibility to self-evaluate their frailty through physical activity, cognition, sleep, nutrition using our app. They also have the possibility to visit our website, but also come in our hospital to have an on-site assessment. We also have a teaching module for healthcare professionals about healthy aging.
Hi everyone, my name is Agathe Pignon, and I'm a behavioral neurologist at Hôpital Lariboisière, Paris in France, and an Atlantic Fellow for Equity in Brain Health. With GBHI, I had the opportunity to spend 1 year in CSF in the 2023 cohort. And for the 10th GBHI birthday, I will be talking about sleep and its impact on brain function, and talk about how a good sleep can promote healthy aging.
Hi, my name is Laurent Cléret de Langavant. I am a French neurologist. I will speak today about the danger of eating ananacea fruits, such as corosol, graviola. And these fruits are very popular for the taste and for traditional medicine applications in tropical regions. However, researchers know that these fruits contain toxic components that affect the neurons in the brain, and they can cause moderate symptoms such as in Parkinson's disease, but also cognitive disorders and brain atrophy. So we want to share information about this.
Hello, I'm Eleanor. I'm a French neurologist working at Sorbonne University in Paris. Thanks to the long-term support of GBHI, I developed 2 programs for children and teenagers that have been implemented in France, Ireland, with Ukraine coming next. The first program promotes brain health. The second one empowers youth to better understand disability and inclusion. During the Brain Bus conferences, I will bring these 2 programs' messages to both children and adults. I'm very glad it helps reduce social health inequities from an early age. Huge thanks to GBHI and happy birthday!
Belgium.
On est fiers de vous présenter le programme REVA Senior qu'on a développé depuis 1 an et demi à Nivelles avec mes collègues Dr. Hassana et Dr. Denouet.
et Jeanne qui est très solaire, et avec toute l'équipe de l'hôpital de jour gériatrique. Et donc, c'est un programme qui a du succès et qui est parti de l'idée que la prévention était importante en gériatrie. En tout cas, il y a un article qui est sorti en 2018 et puis recorrigé en 2020 dans le Lancet, une revue vraiment importante qui montrait que les troubles de la mémoire pouvaient être décalés, en tout cas être ralentis de manière plus importante qu'avec des médicaments en faisant de la prévention.
Now let's go to Mauritius.
I choose community brain health because it is where people live together, learn and grow. In Mauritius, there is not much awareness on brain health, prevention, and dementia. Therefore, by bringing brain health into communities, we are reducing stigma, promoting prevention, and engaging children, women, and senior citizens into culturally meaningful activities and bringing equity closer to people. Thank you.
And now let's go to Congo.
Hello everyone, I'm Dr. Emmanuel Epenge, a neurologist from the Democratic Republic of Congo. As part of the Brain Bath project, I'm honored to join you in celebrating the 10th anniversary of the Atlantic Institute. To mark this milestone, I'm presenting the film Coco Suzanne that fights the stigma related to Alzheimer's disease and dementia. I invite you to watch it all. Happy anniversary to you all. Let's keep moving together.
And our bus will now stop at Togo.
Hi everyone, my name is Maoli Lawson, Atlantic Fellow for Equity in Brain Health, cohort 2024 at UCSF. With grateful hearts, we join in celebrating the 10th anniversary of GBHI with an event here in Togo Lomé called Ahon Talk, Echoes of the Brain. What are we up to? We are gathering in our community to share one important message: healthy brains, healthy aging. We are so deeply grateful to GBHI for the support, for the vision, and for the impact over the years. Happy anniversary, GBHI. Here's to many more years. Thank you so much.
And of course, with that, I would like to thank all of our partners and especially La Fondation Alzheimer. Now you will see a short presentation from Professor Philippe Amouiel, who is the president of this association.
Since 2021, Fondation Alzheimer has been a partner of the Global Brain Health Institute. Our non-profit organization is dedicated to advancing research in Alzheimer's disease and related disorders. In that context, we encourage and support young scientists and clinicians to candidate to the Atlantic Fellow for Equity in Brain Health programs. To mark the 10th anniversary of Global Brain Health Institute, we supported the International Conference on the Road to Brain Health, organized by the French-speaking awardees to raise public awareness about prevention.
Hello, we're the Francophone crew for the Brain Bus. Thank you.
GBHI Togo.
GBHI Belgium.
GBHI France.
Paris. Lille.
GBHI RDC.
GBHI L'Île Maurice.
Joyeux anniversaire.
Happy birthday. Joyeux anniversaire. Joyeux anniversaire.
Wow. Thank you so much to our Francophone site. We want to welcome you all to the camera. Please, can you turn on your cameras, the videos, so we can see you? We would love to hear some remarks. Wow, and there they are. I believe we're welcoming them from an event that happened today in Lille. Can you say more? Can you share more about what happened?
So, thanks. It was a huge success today. And yesterday we discussed with children and teenagers about brain health. We danced with elderlies in Belgium, and we explored new avenues with clinicians and researchers. And above all, we had great fun, which is fantastic for the brain.
We love seeing your brain bus. I don't know about you all, but I want to jump on that bus myself. Let's go. Are there other comments you'd like to share? Any other remarks? Or we're so happy to see you, all of you from these different cohorts.
Yeah, I think in parallel to engaging with the community over those 2 days, what is important is that I believe we now paved a new road for brain health in French-speaking countries, including, as you could hear, Togo, DR Congo, Mauritius, Benin, France, and Belgium. And for this, we also want to thank GBHI for the vision, from the long-term support, because the inspiration comes also from all of you. So huge thanks. Happy birthday. Bon anniversaire. Bon anniversaire.
Thank you all. Thank you, Yao, for your leadership, and the whole group, all of you. Wonderful. So we're going to move from Lille, France, back into this room in San Francisco. And next up, we're going to have a small group of our faculty join us to think about the GBHI values. It's a reflection on what these values mean in action. And so I'm very happy to bring to the front, you can sit on these chairs here, I'll have microphones for you, Dr. Sergio Lanata, who is a neurologist here at the UCSF Fine Memory and Aging Center and with GBHI, Dr. Kate Rankin, who is a neuropsychologist in the same institution, also with GBHI, and Dr. Virginia Sturm, also neuropsychologist here with us at the UCSF Fine Mac and GBHI. So we'd love to hear from you and folks online. We hope that you can see the three speakers, and let's hear more about the GBHI values in action, what that means for us immediately and for those in the world beyond.
All right, well, thank you so much. I'm very moved by all these presentations. I think what a greater testament to the values of GBHI than everything that we've just seen. It's amazing. We're gonna offer some reflections around values. I was thinking about this yesterday. And I thought, man, you GBHI fellows are lucky because they get to see the values. They see the values crystallized from the onset of the experience. But when I joined the MAC, when I was a BNTP fellow, I discovered the values of the MAC, which are also the values of GBHI, by observing behavior in my mentors and my colleagues. So let me give you some examples. I was lucky enough that at the beginning of my experience as a fellow here, I worked with Mary DeMay, a clinician that many of you may have met. I remember, so when we see a patient, we write a patient report, a note, right? And I remember feeling very proud of my notes after seeing this first patient and sending my note to Mary DeMay for a review. And the email I got was essentially said, Sergio, we don't write notes like this here. and I was taken aback, and then I realized, what she was telling me and what she told me later was when we write a note knowing that patients and families are going to see the notes. And that changed entirely the way that I was framing note writing that no one had ever mentioned to me in my whole training experience. So that was one snapshot to your point, Bruce, of like having snapshots and memories of a movie. I remember how I felt. I remember the change that brought onto me. That experience and many other experiences I've had with Mary DeMay. Next to Mary DeMay was and still is Michael Geschwin's office. There's Michael in the back. I was also very lucky to work with him early on in my fellowship training. And I went through the experience of writing a book chapter with Michael Geschwin and a paper, and some people are laughing. It was an incredible experience where every single sentence matters, right? You look at each sentence, you link it with the previous one, the ones to come, you zoom in on the periods and the commas. And that was just such an edifying experience. I never had an experience like that before, and open to all of it. And I can see looking back, how that really shaped, and I can go on and on with snapshots, moments that really shaped the doctor that I became here, that I wasn't at the end of my residency. So I'm deeply appreciative to my colleagues for shaping the physician that I am. And so it was very, very beautiful for me to see and experience these values through my experiences as a BNTP fellow, and then see them crystallized in GBHI. Those values, and which we haven't here yet, those values and others, I think that my colleagues embody. And I feel like I'm never going to live up to, Mary the May, Michael Geschwind, these individuals to me are something that I aspire to, and my colleagues here as well. And that's what's beautiful. I believe that these values are ultimately what holds an institution together. And to your point, Bruce, I think they also help us weather storms, because when things are bad, either at a personal level or colleague dynamics, family dynamics, whatever, just knowing, being aware of what the values are of your institution, the values that people hold, is what really brings you back to the basics and helps you keep moving forward. So I think that's something that we're going to hear more about. I think that we're all seeing how these values are really shaping the work that GBHI fellows are doing. And they become kind of guideposts. You judge yourself according to your values, you judge your past actions according to your values, and your aspirations according to your values. So they're really fundamental.
In reflecting on the power of these values and the curriculum in GBHI centered around those values, I really have two observations, two reflections that I wanted to make about it. One of them was, many of you know that these show up in many places, but we actually do salons around these values. And so for those salons, most of you know, 3 of the fellows get together and they are asked to create a program. And that program can include teaching and drama and art and interactive activities and spoken word poetry and all kinds of things. And as you can imagine, when those 3 fellows first sit down to do that planning, it is a microcosm of diversity of opinion, diversity of plan. We have people who are from all different backgrounds, all different experiences, and everybody has a very different idea about what's supposed to happen. And I love the fact that that is a microcosm of what we do in our working lives every day. And yet, because the salon is about a value, I've been lucky enough to be on the respect team for a few years. So, but my salon that I've guided is respect. And when we know that the salon's about respect and we're talking and asking each other, what is respect? How do we show it? What does it feel like to be disrespected? It changes the way the fellows and the team interact. We suddenly, at the forefront, have to really think about how to respect each other, even when we really disagree. How do we make space for each other to plan, to create this program? How do we disagree? How do we come to consensus? How do we make something new happen that we weren't really planning in the beginning? Wasn't what we imagined in the beginning. That experience of really having the value be a core part of the activity, I think all of us take that forward into our work lives everywhere, into our interactions everywhere. It is very powerful. And that's one observation. The other one that I was going to make is just about the degree to which, you know what, I'm realizing we're trying to go short, so I'm not going to make my second one. I'm going to turn it over to Virginia. Actually, I just changed my mind. But go ahead.
Are you sure? Yeah. Okay. Well, I've also had the privilege of being involved with GBHI for a long time. And in the days before we had fellows, and this was just like an abstract, imaginary game we were playing of like, who would these people be who would join us and who would take this leap of faith and move to San Francisco for this fellowship. And, Leah mentioned everything was intentional and the values were also very intentional, but we really didn't know how to weave them in or even what they were at the beginning. And there were lots of discussions about like, what is it? What did we mean by being an Atlantic Fellow at GBHI? And we talked about like the core things we all needed to learn. And did everyone need to know neuroscience and neurology and health economics and neuropsychology and the arts and creativity? And we knew that everyone couldn't become an expert in all of those things. And we tried to think of classes that would teach, parts of all those elements. But, a year goes by really quickly. So we were like, we can't do all of that. But what is like the essence still? Like, what are the things that everyone needs to share? And then I think we had this collective realization that it was the values, and the values were what ties everyone together. So even if you're a neurologist or a musician, no matter where you come from or what your professional background is, it was the values that connected the fellows. And once we realized that, then I think it all became clear about the mission and what we were doing. And then it was just how to, bring them into life in the salons and in our daily experiences.
Yeah, they bring people together. We were going to do a little bit of a back and forth, but I think given that we're over time, we decided to keep moving. So thank you all so much. And yeah, thank you.
Thank you. Thanks so much to the three of you. We appreciate you. And we also want to give great credit to the wonderful Caroline Prudhoe, who designed this slide, created it herself. Caroline is integral to GBHI, as each of our generations of GBHI community know. So beautiful, Caroline. Thank you so much. So we're moving from the GBHI values and how they ground us and continue us into our lives beyond this community as we go out into the world. We're going to now go to Kampala, Uganda. And we're going to hear a little bit from Rodney, who is an artist in Kampala, and he's conducted a very exciting project that was an arts and memory cafe. Let's watch a little bit more to learn from Rodney. And before we do that, I just want to recognize while we are a few minutes over time, we will continue going to hear from this site, and we have one more site to round out our 5 global sites. So we appreciate those of you who can stay later with us, both here in the room and online. And we will just go a little bit over. So with that, let's check out what's going on in Kampala.
Hi guys, my name is Chiguno Rodney. Founder Memory Mosaic Initiative and Chiguno Art Studio. I'm here to welcome you to the Art and Memory Cafe, an informal style event that we put together to bring together art and brain health. We have a lot of exciting things to look forward to during the day: dance, arts, brain health talks, some storytelling, and a lot of fun activities that we're going to do: quizzes, games, and also getting to know each other. So welcome here at Era 92 Hub. We are almost starting, so don't miss and make your way here. We are waiting for you. We are strangers become collaborators. We are stories of growth. We are here today not to just celebrate, but to celebrate the 10 years of the Global Brain Health Institute, which is an institute dedicated to protecting the world's aging population from threats to brain health across the world. I'm happy to be one of the first Ugandans to be part of the Atlantic Fellows Solution Development. As an artist, I feel privileged to be in a space of different experts working together to see that we have optimal brain health, not just in Uganda, but across the world and across Africa. GBHI strives to improve brain health for populations across the world, reaching into local communities through its global network of fellows from the Atlantic Fellows in Brain Health Program. As GBHI celebrates 10 years today, bringing people together from across the world. The Art and Memory Cafe is just one of the many 10-year celebrations happening across the world. So this is one of the many that are happening across the world. So we are privileged to host part of the celebrations of GBHI. And these are basically organized by fellows, people like me who are part of the program, who are working towards advancing brain health across the world in their different communities.
Hi, everyone. My name is Hazel, and I'm a psychologist. Today, I spent the entirety of the day having fun, laughing, and dancing at the Art and Memory Cafe. We are right here at Era 92 Hub, and it was absolutely amazing. From the moment I walked in, I could feel the vibe. I could feel all my creative juices flowing. I really enjoyed the experience. I think my favorite portion of the day was the dancing. I typically only dance by myself in my house, but having Jerry as an instructor, having to follow the steps, but also having fun with it was something I really, really enjoyed. Yeah, thank you so much to the organizers, Rodney, and everyone. And yeah, I'm so glad that the Global Brain Health Institute is making 10 years, and I love what it's been doing. Hello, everyone. I'm here at the Art Memory Cafe. It is the 10th year celebration of the Global Brain Health Institute. And I'm here as one of the facilitators. I am Annie Pink, also a psychotherapist who works with neurons, linguistics, and programming of the brain. So to talk about today, it has been amazing. I got to meet people in different age groups from 12 years to 60 years and above. So it was the most engaging event and lots of creativity, lots of ways to understand how important it is about brain health. We had dancing, we had knowledge sharing by different doctors, we had sharing by a nutritionist. So it was a holistic event. And the kind of feedback that we got from each and everyone and how interesting life is about. It was a time to learn more about what you want to know about your brain health. I'm really happy that I got the opportunity to be here to talk about the importance of brain health. How much do we talk about our physical health? We check the blood pressure on a regular basis to see, am I healthy? But have we thought about the brain health? Have we checked about it? So in my session where I shared a lot of details, there was amazing feedback and amazing responses from people saying that such kind of sessions are more needed. We need to talk more about brain health. We need more knowledge. We need to understand what's happening here in the command center. So it was an amazing session. More sessions to come. Remember that brain health is very, very important for you to have an amazing, happy life and a life to your fullest potential.
Pain stress is activated in your body without anything chasing you that's visible. You feel the exact same emotions, but you're going nowhere. Your body, to take you from 0 to 100 in 1 second, guess what it has done? It has turned your good fat, it has turned your protein, your muscles, it has turned whatever it can. That's why they call it survival, into glucose. Because glucose is fuel for the body. So it has turned it into glucose and dumped it in your bloodstream.
Hello, my name is Pamela Natasha Bugembe. I am a Uganda. And I want to start off by congratulating the Global Brain Health Institute upon reaching 10 years. Shout out to you guys. Today has been very educational for me. The most fascinating thing I have learned, and I've learned a lot, but it has been brain atrophy, that your brain shrinks over time. That was so fascinating. I didn't know what that was. I also learned how to take care of your brain, the 7 pillars of mental health that I won't get into, but the most important is sleep. It has been a fun session, an educational session. We've done so many fun things that you would not expect at any conference. So it has really, really been overall amazing. Thank you.
Well, hello everybody. My name is Naluwandera Shatra. I am a poet and a mental health advocate. And today, spending time at R92 at the Art and Memory Cafe has been so beautiful. It has been so amazing, really memorable, just like its name. You know, we've been able to get a chance to interact with so many creative people. We've been able to interact with so many professionals in the field of brain health and mental health. This has really impacted my life so much. I've been able to understand how I can take care of my brain health and mental health as a whole. This has been really of great impact, and I hope that each and every one out there gets the chance to, get to learn about how their mental health and brain health gets to run, such that we may not lose our beautiful and precious people in such a web of mental illness. Well, right now, I would take this pleasure to wish a very, very, very good, happy anniversary to our good people, the Global Brain Health Institute. These people are so good to us. They have been able to teach us how to take care of our brain health, mental health, such that we are raised into professional, good, and well-operating citizens. Thank you so much.
I am at Era 92 Hub, and today we have been at the Art and Memory Cafe, sponsored by Germany partners. So it's been a great experience. People have learned about brain health and how to take care of their brains, mental health as well.
Awesome. Rodney, are you with us from Kampala?
Yes, I'm right here.
There he is. Welcome and congratulations.
Thank you very much. Thank you, Camelia. Hello, everyone. It's a good evening from this side. This is Chiguno Rodney, a visual artist and an Atlantic Fellow for Equity in Brain Health. I'm so humbled to be sharing this and to celebrate the 10 years of GBHI. I'm so privileged to be one of the fellows, the first fellows from Uganda to be part of the global network. And it's an honor to have put this together. The Art and Memory Cafe, an informal style event that we brought together different practitioners, artists, caregivers, people with lived experience, some hospitals as well, but also get to see how we can talk about brain health in a way that is more accessible, more friendly, more fun, and more creative as well. So it was an exciting event that happened last weekend. We were able to have some children learn some books about mental health. We were able to have a memory wall created where people wrote a couple of memories they had from their past. We were able to also have some exciting performances from some people as well. We were also able to get some people checked because we had some rapid checkups by Ruby Hospital, who was one of our collaborators. And it was an exciting event. We're looking forward to having more of these in Kampala, but also anywhere across the world. Thank you very much.
Thank you, Rodney. We feel your energy. We can just feel your energy coming off the screen. It's phenomenal. Thank you so much.
Thank you.
Take care. Pretty awesome. Okay, so from Kampala, we are back in San Francisco, and I'm very delighted to bring up front and invite, for folks who are joining us online, let's welcome Chris Exley, who has been with GBHI for years and years as a leader from the Atlantic Philanthropies, and also is himself a philanthropic professional. We're going to hear a little bit from Chris about Chuck's vision, Chuck Feeney's vision that was the start of all of this, and then where we are today. So welcome, Chris, so much.
Thanks, Camilla. Thank you, Camilla. I'm mindful our time is limited. I had asked Camilla, what I could say, and she asked me to talk a little bit about Chuck's maybe values and the roots of equity in the programs that Atlantic funded. And I asked for an hour, and she gave me 5 minutes. And but also I'll try to cover just some key notes that I have that I think reflect Chuck's perspective on what we call equity. And I want to give it a different twist than I think what we've historically viewed equity as. I think Chuck didn't use the word equity. He used the word fairness, and it's part of a force, the values that GBHI supports and espouses. But I think that for Chuck, equity was an opportunity and an emphasis on the need for excellence to address opportunity. And I just want to focus on the notion of equity as opportunity and the need for excellence in addressing that opportunity. Chuck was a value investor, meaning he saw value where others didn't see it. And he wanted a high return on his investment. So he looked in places and among people who were often overlooked. And I think equity represents an opportunity to address significant needs where the opportunity to make a difference is the greatest. Where there are deficits, where there are needs, there are great opportunities to make a difference. And I think Chuck viewed equity through that lens. To make a difference requires excellence in skills and values, observation skills, the ability to address the needs in effective ways, the ability to be good at what you do and be effective in influencing others and making a difference in the spaces you wish to make a difference in. So when I think of equity, and through Chuck's perspective, I think of those opportunities to make a difference where there are great needs. And to do that, not with second best skills, not with second best people, but with the best you can bring to that space to make a difference. Equity is taking a beating, certainly in this country today. The notion that is prevailing in some circles, some narratives, is that equity is an excuse to allow people who are second best to be given an opportunity that they don't deserve. And I think it's really important that this community reassert what it is that you are doing, why you're doing it, and acknowledge that you are operating in the areas of greatest need to make the greatest difference with excellent skills. I know that Chuck had an opportunity to meet many of the fellows in the early cohorts. You may know that in 2013, Chuck suffered some health events that limited his ability to participate in a lot of the activities that mattered to him. But he had an opportunity to be with many of the fellows, many of the cohorts who were on this call, and he saw that. He saw that what you were doing was addressing areas of need with excellence. And I just hope that you will carry that forward in your acknowledgement of who you are and what you do. And I'm only sorry that he's not here today to celebrate with you. I think what you are doing, what you've been doing, how you do it, and who you are the embodiment of Chuck's aspirations. And so I congratulate you. I congratulate the staff. Grateful to the Alzheimer's Association partnership, which has really raised the level of the work in your pilots and your activities. To Bruce, to Victor, to Shireen, to Stacy, to Niall, to Camilla, who I want to celebrate, who is concluding 8 years of terrific work. And just very grateful for all you have done to help realize Chuck's vision and aspiration for equity in the world today. Thank you very much.
Thank you so much, Chris. You keep Chuck's spirit alive, and we're hearing your message of it coming alive and staying alive with the fellows as well, and all that they do, and our full community. I want to also acknowledge quickly my colleague, Mindy Matthijs, who will be retiring very soon, and we want to appreciate her and what she's contributed to this community. As our final satellite, and again, we appreciate so much those of you who are staying with us a little bit later. We are nearly there in our journey around the world. We have arrived. We have arrived in Australia, and we're going to hear next from our Oceania region, led by Susanna Rohr, with several fellows who are there with her from Australia, from New Zealand, from other sites. And believe it or not, friends, you can imagine what time it is in Australia. It is very late, or we may say very early, one of the two, because it's just well beyond when we would usually sleep. They are having a nocturnal gathering around a campfire in a place called Uluru, and we're going to learn more about it in just a sec. So let's watch this video.
There is a part of the world that does not begin its day when the rest of the world does. While cities pulse, while markets open, while timelines fill with urgency and output, this region sleeps. Far to the south, across vast oceans, Oceania turns inward. Here, time moves differently, not absent, but slow, not empty, but held. Under these skies, among the oldest living cultures on Earth, night is not a pause in productivity. It is a condition for restoration. This is not a place without pressure, but one where different rhythms still persist. The center of this landscape stands Uluru, a place of deep time, story, and continuity. Here, the boundaries between land, people, and memory are not separate. They are lived as one. In this part of the world, health has never been only biological. It is relational, cultural, environmental, and increasingly, Atlantic fellows in Oceania are asking a new question. What does it mean to care for the brain in a world that rarely slows down?
I'm Alison Canty. My focus is on education and finding the ways to reach the people who are at the highest risk of poor brain health. Here in Oceania, I'm working with people in my local community who are affected by dementia, and I'm helping them to share their stories of life, not only the challenges, but also where they find joy, pleasure, and hope.
Hello, I'm Fumia Kindidre, based here in Hobart, Tasmania, and I'm currently studying the interconnections between brain health, nature connection, and art. And currently here in Tasmania, we're beginning to understand how people living with dementia connect with nature and land through participatory creative activities.
Hello, my name is Miguel Renteria, and I'm a fellow based in Brisbane. My work has to do with understanding the genetic and biological basis of neurodegeneration. I believe in medical research being more equitable, diverse, and inclusive. And even though Oceania is a continent that is geographically isolated, it is also a special place where different cultures and peoples meet, connect, and work together to build a more fair, equitable, and prosperous future.
I'm Kim Hoon from Brisbane, or Mianjin, as the First Nations people have always called it. I grew up in Vietnam after the war, where people had very little, but they had each other, and the community and closeness keep the body and mind very well. I carry that insight with me now, working in the communities and health services and teaching public health students, asking who get the resources for good brain health and who doesn't, and what can we do about it.
Hi, I'm Sarah Cullen, and I'm based in Auckland, New Zealand. My work focuses on the interethnic differences in brain health. But here in New Zealand, I've learned about the tremendous importance of family, community, and a sense of belonging. And it makes me think that maybe brain health isn't about trying to do more, but is actually about rediscovering what we've lost.
My name is Ruthan Gichu. I am studying brain health and aging. I am always reminded that memory concerns is not normal part of aging, but more of an opportunity, a window of opportunity that we all need to explore.
Hi, I'm Susanna Rohr. I'm based in Sydney, Australia. And my work explores how the environments and conditions we live in shape lifestyle and brain health across the life course. And here in Oceania, we are learning how connection to place, to nature, to rhythms, and to ourselves are strong protective factors for brain health, really showing us that restoration and groundedness but just as important as performance for our brain health.
Across Oceania, we explore a different set of strengths, quieter ones, time that allows recovery, cultures that center connection, environments that remind us that the brain is not separate from the world it inhabits. In an era defined by acceleration, these may be among the most important resources we have. As the world continues to perform, produce, and to optimize, Oceania may offer a different lens. At the 10-year mark of the Global Brain Health Institute, Aussie fellows come together not to accelerate, but to listen, to explore what quiet strengths this part of the world brings to brain health, and to ask what the rest of the world might learn from the Oceania night.
And we're very excited to welcome Susanna and the group who are gathered around a campfire to join us. And thank you for being up so late. There they are.
Hello, everyone, and welcome to Ulara in Central Australia near Uluru. As you just heard, here it is well after midnight, actually 2:30, as we connect into this global celebration, but we cannot think of a better reason to stay up and join you guys. We are surrounded right now by desert darkness, starry night skies, quietness, and one of the oldest landscapes in the world. Uluru is not just only an iconic landmark, but it's a place of deep cultural, spiritual, and also environmental significance. And we intentionally chose this place together to mark the 10 years of the Global Brain Health Institute, as it brings different perspectives to brain health. We're looking at the slowness of the night, the significance of place, and much, much more, which my fellow fellows who are sitting here with me around the campfire will share with you in a minute. But before we continue, I would like to acknowledge exactly that, the country on which we gather today. We acknowledge the Anangu people, the traditional custodians of the land on which we gather today here on Anangu country in Central Australia, and pay our respects to elders past and present. And we extend that respect to all Aboriginals and Torres Strait Islanders people joining us today, and to Indigenous peoples joining us from around the world. We really recognize the deep connection between land, culture, community, as well as well-being, and the knowledge systems that have sustained life here for tens of thousands of years. Today, we are visitors to this magnificent place, and that's why we come with humility, gratitude, and an intention to listen and to learn.
So, what if the optimal conditions for deep thinking are not in a lecture hall, but at Uluru? Neuroscientific evidence tells us all quiets the default mode network, which is the brain set for rumination and thus enabling creative insights. 4 days under this uninterrupted sky synchronizes our circadian rhythms, directly enhancing quality sleep and the next day's cognitive performance, despite it being 4 a.m. in a short while. Critically, Uluru is not merely a landscape. It is a living archive of 6,000 decades of Anagu knowledge, where Jukulpa binds ecology and story. It is also a neurological gift. This context transforms our workshop from an abstract discourse into a grounded, interconnected inquiry. 1 day is tourism. 4 days is a deliberate neurobiological and cultural intervention. And it is true, we can meet anywhere, but only here do the conditions for cognitive reset, deep rest, and epistemic humility converge. That is why Uluru, that's why 4 days, and that's why now.
So while we were here, we wanted to invite others to join the experience with us and to share in the 10-year celebration. And yesterday we watched the sunrise over the land, and then we hosted a webinar live streamed from the outback. We took what has become a really standard academic activity for us, highly structured, predictable, planned, a little bit like today, but it was out in nature. And if you were one of the 65 people who joined us, you might have seen the bright sunshine, the red earth, the big blue skies, the flies on our faces, and the wind in the trees. What you didn't see was the laptop stand, the battery, the Starlink connection, and all of the work that we needed to bring others into this space with us. And that was part of us adapting to our environment and finding a way to share it. In these parts that have been unchanged for millions of years, time just slows down, especially this evening. Nature protects and it nurtures the land. These rocks that buckled up out of the earth 550 million years ago were formed, and the sea levels have risen and fallen many times, but the rocks are still here and they still remain. And we're here to learn about this from an academic perspective, but also an experiential perspective. And research has shown that connecting to nature can restore attention and reduce cognitive load. And Miles Richardson, who's a professor of nature connection, has shown that people's connection to nature has actually declined by more than 60% since the 18th century. And he identified 5 pathways for connecting to nature: contact, beauty, meaning, emotion, and compassion.
As we reflect on our time here, we extend our gratitude to the Nango people who have been custodians of this land and remind us that when we care for country, country cares for us, restoring our minds, our brains, and our sleep. We extend our deep appreciation to the leadership of the Global Brain Health Institute for the opportunity to connect with fellows here and around the world. Happy 10th anniversary. Happy anniversary. Happy anniversary.
Thank you so much to all of you for staying up, for gathering around the campfire, and for reminding us about the connection to nature, to place, to our roots, and to the communities that are so close to the land in prior times and now. We really appreciate you. That is awesome. And please get some sleep soon. Okay, friends, as we are rounding out this time, I am very delighted to bring back up front our site director, Victor Valcourt, to share some closing remarks. And I also just want to express thanks on behalf of our whole team to Victor. This concept of having global satellite sites was Victor's idea. And I don't know about you, but I feel very inspired right now. I feel very moved by what I've seen from the leadership of our Atlantic fellows from all over the world. So thank you, Victor, for this concept. And thank you to all of you for being with us. And I'm going to pass it over to Victor.
Yeah, well, and Camille, thank you for all the work and all the staff. This was clearly, to me, an example of what happens when you let other people lead. I could never envision this. It's unbelievable. We need to do immediate M&E and do this every year. We need to find out what worked and didn't, because it's a global community, and that's what you saw. And I'm just gobbersmacked. I can't believe what's happening around the world, and the synchronicity of this and the celebration. I can't think of a better way to celebrate this program than to elevate the people around the world who are making it a living movement. We'll do it again. So it's late. Thank you, everybody, and certainly Camille and the team for pulling this together. Our AV team, and my apologies for running a bit late. But let's have a little break. And Neil and Niall, of course, yeah.
Okay, friends, we're going to wrap up. For those of us who are here in the room, we're going to take a 10-minute break and then we're going to come back. And please know there is something very exciting that's going to happen next, which will be some live dancing led by Atlantic fellow Laura Calderon Cuevas. Please do check out the art that is upstairs and downstairs that is presented by Creative Minds and Veronica Rojas, who is an Atlantic fellow. For those of you who are online, we thank you for being with us for so long. We do appreciate that this session lasted a little bit longer than we expected. Thank you for celebrating with us. Thank you for witnessing the work of our Atlantic Fellows around the world. And thank you for continuing to be part of a movement for equity in brain health. Thank you, everybody.
Everything is everything. What it meant to be. After winter, must come spring. Changing to leave.